So related to all these, the patient has a lot of confusion that what she has to eat, what not to eat. So being a practitioner, once the patient approaches to us, patient's first question to us, ma'am, is there a certain guidelines for the menopause? So related to discussion for all that, I invited today my very dear friend, Dr. Yazhini, ma'am. So ma'am, a very, very warm welcome to you, first of all.
Yeah, good evening, Ritu, for your wonderful introduction. And it's a pleasure to be with you today evening and to discuss about the diet that to be taken by the menopausal women. We all know that there are three important stages in a woman: puberty, pregnancy and lactation, and menopause. We know that menopause comprises of lot of changes, both hormonally, psychologically, and so many things that affect us. And we know that diet plays an important role. So what we eat can help us to reduce our symptoms and help us ease this transition. Okay, you can shoot
So,
out
ma'am,
your.
my first question, yes, ma'am. So, my first question related to that only. So, as you have very rightly mentioned, that the three phases of the female life. So, once being a gynecologist, once we start our practice and starting sitting in the OPD, sometimes the young lady is coming for the infertility treatment, and we are advising her, yes, you have to eat this, you have to eat that for the fertility booster, as you are also infertility specialist. And besides that, if some elderly woman is coming along with her mother-in-law or mom, then at the same time they have a query, ma'am, as you have just suggested about the infertility diet, is it something like the menopause friendly diet also? So, ma'am, will you please enlighten us about that?
Yeah, definitely there is lot of diet to be taken by a menopause woman. You have to eat and drink at least 2 or 4 servings a day, and products of calcium rich diet. These dairy products are very, very important because calcium is very much needed. About 1.2 to 1.5 grams of calcium per day is very essential so that our bones will have the proper density and we can prevent fractures and other things. And let us see what are all the calcium rich diets. You have yogurt, eggs, milk, cheese to some extent, and the vegetarian diets are broccoli and legumes, all such things. And the fish is also very good. Fish with bones, like salmons and sardines, that offer very good calcium rich diet. And eat at least 3 servings of iron rich foods uh, per day. And
So very, yeah, very
yeah,
rightly, yeah, very
yeah,
rightly you have, ma'am, pointed out that intake of calcium is very much important. So whenever, friends, we are prescribing the menopausal diet, so we have to remember that we have to give the supplements that will give at least 1000 to 1200 mg of the calcium per day. So now market is full of the, ma'am, different kind of the calcium supplements. So usually because this program is very popular amongst the resident doctors also. So the first question they ask that, ma'am, which calcium do you advise? So,
yeah,
is it any preferable choice of yours, ma'am, or what you suggest?
yeah. The calcium containing vitamin D3 and vitamin K. That is very essential because K prevents the calcium deposits over our uh, uh, vascular system, and thereby the calcium plaques cannot occur when we combine calcium with the vitamin D3 and K. So that type of calcium is the best for. There are few products which have this vitamin K as well as D3 along with calcium. So such things is good for health, but we have to supplement it with our diet. That's very, very important because all dairy products are rich in calcium, magnesium, phosphorus, potassium, and vitamin D3, and this K and other things also. It's very, very, very important. So not only we depend on the tablets, we have to depend on our diet Of course, nuts, we should not forget nuts. Almonds
True.
are very, rich in that. And we have this chia seeds, flax seeds, and so many things, green leafy vegetables, berries, all such things can can boost our, means it can reduce the symptoms
Yeah.
and can help us
Correct.
to lead a healthy menopausal life.
Correct. Correct. So, as Madam has very rightly pointed out, yes, we have to include this nuts and seeds also in the diet of the menopausal ladies. As we all know, once we give these are rich in the omega fatty acids and having a some source of the phytoestrogens also, which is very important for reducing the hot flushes. As very rightly she has pointed out about the flax seeds, yes, very important. We advise fennel seeds. We advise this flax seeds,
Yes.
fennel seeds. Both are very good for that. Rich in omega fatty acids and helping for this phytoestrogens also. So thank you so much, ma'am. Namrata, while introduction, you forgot the very important thing. Madam is currently as a secretary for the Madurai Menopause
Yes, ma'am,
Society.
I
Madam
said
She
this.
mentioned. She
Yes, I
she
mentioned it.
mentioned,
mentioned,
ma'am.
acha, acha,
Yes.
acha, okay, sir. Then, so ma'am is doing a lot of work for that. Huh?
Yes, ma'am.
So, ma'am, my next question to you, as we all know, in the menopause, there is a imbalance of the hormones. We all know the AMH is but down, FSH is raised, LH is down. Again, the lady is having a lot of hot flushes due to estrogen progesterone imbalance, hypoestrogenemia. So, you think these foods will help in the balancing the hormones? What's your recommendation for that?
Yeah, definitely. What we eat matters, and we can support the hormonal imbalance by taking essential nutrients and compounds that influence hormone production, metabolism, and overall body function. These include the cruciferous vegetables, leafy greens, berries, fatty fish, nuts, seeds, and certain beverages like green tea. And you can take amla juice, that is very good for health. And this ABC juice, apple, beetroot, and carrot together, have it, make it a smoothie and take it daily, because I'm taking that daily. That will help us.
Okay.
It's a very good antioxidant, and that also helps to balance the hormonal problems. Yeah.
So, yeah, very nice, ma'am. So, friends, as just now the madam has pointed out, yes, the ABC juice is having particularly very good effects, yes, for the menopausal ladies. And in fact, we are advising this to the young adolescents also who are having a lot of
Yeah.
bleeding issues also, it's basically act as an energy drink, having a lot of
Yeah.
antioxidants. So it's a very, very good. So thank you for sharing for that point, ma'am. Yes, as madam has rightly pointed out about the amla juice. So yes, we know amla is the richest source of the vitamin C. So while giving the prescription for the menopausal diet, we have to specify, yes, they have to take amla, they have to take vitamin C in the form of the lemon, because otherwise the patient sometimes asks, ma'am, you have written the vitamin C rich diet. So what the things are having, how much of the vitamin C? Guava is very good, oranges are very good for the vitamin C. So we have to specify all these. So, ma'am, coming to the next question, as we all know, in the menopausal ladies, the most important symptom is the hot flushes. Mostly the ladies who are approaching to us, they are saying, ma'am, everybody is sitting comfortably in the AC, but I am full of the sweats. So, do you think that what dietary components are very much helpful for this hot flushes?
Yeah, the phytoestrogens are very
Yeah.
essential to get rid of these hot flashes. And as I already told, that the flax seeds, chia seeds, nuts, and green leafy vegetables, legumes, and they are all very good in this phytoestrogens. And soy foods, we should not forget that. Soy products like tofu and tempeh and soybeans, soy milk, everything. They have a lot of isoflavones which mimic the estrogen, and thereby can relieve us from having these hot flushes and other things. And sesame seeds should
Sesame
be
seeds,
also,
yes.
and various berries. Yeah, they all have this phytoestrogens, which will help us to get rid of this mood swings and other things. If it is more, then we have to go for HRT.
Yes.
If suppose
So,
it's high.
uh, yes. So, very nicely, Madam has
We have to
pointed out.
start all these things in the uh, premenopausal by the age of
Yes,
40
yes,
itself. If you have started it, we can
yes,
smoothly
yes, yes.
go through this menopause. Yeah, that's very important.
Yes, 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 yes. So, as Madam has pointed out, related to for this hot flushes, the all the dietary changes. So, when we are advising these dietary changes, not only to the patients, because once we are going through this 40 plus age group, we all these things we have to add in our diet also. Because being a busy practitioner, it's very easy to write for our patients, but for us, it is very difficult to take all these things. So, Madam has very rightly pointed out. Here, I want to bring one more important point in the focus as for the soya products. So, a lot of patients and doctors still have the confusion that soya products we can't give to the thyroid patients. So last week we have a very wonderful discussion with dietitian Sheila Tanna. I invited her for the program. So she very clear, very scientifically she cleared out the point that yes, we can advise that soya products to the thyroid patients also, but the moderation is the key, and that product should be properly cooked. She only mentioned that the
Oh,
cruciferous
that's good.
vegetables usually, yeah, yeah. That's
Okay,
why
it's a good
yes,
point.
ma'am. That's why I highlighted because I invited one dietitian last week only.
Okay,
So she told ki yes, the so because usually all the menopausal ladies are usually having a hypothyroidism, and once we are saying that for increasing the estrogen you have to take soya products, and again for thyroid we are saying you not to have take that soya products. So she mentioned that all the products you can take, but in the moderation, and that should be properly cooked.
cooked.
So this
Okay.
is the one important point I want to share with all. So now coming to the next question, ma'am, we have discussed about this hot flushes and night sweats. Now my next question is the mood changes. As we all know, all the menopausal ladies are having a lot of irritability, forgetfulness. So what do you suggest? What should be included in the diet for that?
Because you need lot of B complex to get rid of these mood changes and other things. And the dairy products are rich in tryptophan, which helps
Hmm.
us to go for sleep. That's very
Hmm.
important. And all these vegetables, they are rich in vitamin B complex, and they help us to create and use the estrogen, such as the boron rich foods like avocados, apples, raisins, peaches, prunes, and pears, various legumes, peanuts, and beans. These all help us to uh, supplement us with B complex and other things, which will help us to tackle the mood changes and other things. And and also best to have some counseling, have a get together. You can commune with your friends and things. These will help us to undergo the menopause so smoothly. We need not feel alone, or we not feel that we have lost our reproductive capacity, something like that. We have to get rid of all such negative thoughts. And you should always think positively, because the menopause, postmenopausal years, a woman has to live for more than 30 to 40 years. After my mom she is 98 years she old, and she herself feels better. So fruits are very good, and it doesn't harm us. And better go for that, so that they will supplement us with all the vitamins, which are very essential for this menopausal women.
Yeah, very true. Very rightly you have pointed out. So thank you, ma'am. So, ma'am, coming to the another question, as we have rightly discussed all these things. So is it like that something we should avoid to eat in the menopause? As we have just discussing, so because the menopausal ladies usually ask us that, is it like that something what I should not eat
Yeah.
during my this perimenopausal and
Yeah,
menopausal
for
phase?
this for this mood changes, I just forgot to take about the omega-3 fatty acids, which are very essential for tackling the mood
Yeah,
changes, and the emotion. It offers emotional stability. And the things to be avoided are fast foods, all these beverages, canned foods, high salted diets, like all baked foods, all made out of refined flour, oily stuffs, fried stuffs. So these are the things we have to definitely avoid. And best in a plate of ours, half of the thing should be vegetables. Better to have salads or sprouts or something like that. And quarter of that should be protein, and quarter of that should be carbohydrates. So low carb, high fiber, and protein of 1 to 2 grams per kg is very essential
yes,
in order to prevent
huh,
sarcopenia, because sarcopenia is one among the problems of menopause. So you should also have a high protein diet. So if you divide your plate into three quadrants, 2/3 to be all fresh vegetables and fruits, 1/3 carbohydrates, and 1/3 is protein, high protein. Protein, you can get it from lean meat, fish,
yeah,
eggs, egg white,
yeah,
and other things, beans, legumes, and so many things
yeah.
you have.
Yes, yes, yes. So yes, the intake of the protein should be must, because we have seen that lot of menopausal ladies who are approaching to us, ki ma'am, we are usually eating some vegetable and chapati, not including any kind of protein because we are not able to digest. So ma'am, coming to here, this is the question what we are seeing in all of the social media, a lot of publicity related to the probiotics. So what's your opinion for that? Because probiotic, healthy gut is now these days has come
Yeah,
for the
very.
everything.
Yeah,
Yeah,
yeah.
yeah,
The homemade yogurt, that's the
yeah.
best source of
Correct.
probiotics. Yeah.
Yeah,
If you
yeah,
take just 1 tumbler of either buttermilk or curd every day, that is enough to provide you with all sorts of prebiotics and probiotics. So, and also you take fresh leafy vegetables. You can go for soups that is made up of vegetables and greens, spinach. So many things are there, which will provide us with all sorts of essential things. And you can also go for chicken, turkey soups, and something like that for those
yes, yes, yes.
who are lovers of
Yeah,
non-vegetarians.
yeah, yeah, yeah. So very rightly, madam has also pointed out, yes, the homemade yogurt will be the best instead of taking this all the other different type of brands. I don't want to take the name on the show. Different kind of brands are available in the market, which is claiming to having a lot of lactobacillus. But instead of that, friends, you also know that these all the preserved things are having a lot, all these whatever we are getting from the outside the yogurt, they are already containing lot of preservatives in that. So it's much more better that the homemade yogurt will be the best, and that should be made also from the low fat milk, not the
Yeah,
high fat milk. So that is also very important, that because in the menopause again the tendency of the weight gain. So these are the
yeah,
very
yeah,
small
yeah.
points. Yeah, so these are the very small points what
And regarding
uh,
the fibers,
yes,
at
ma'am.
least 25 grams of fibers to be taken in a diet per day, which will
Hmm.
tide over all these constipation problems, and it will help us to lower our blood pressure as well as sugar and so many things. And there was a study which in 2022 which stated that if you take 25 grams of fibers per day, that will reduce your fracture by 8%, it seems. And if you
Very
take
nice.
a lot of plant thing, that will also, fibers from plants, that will reduce by 9% the chances for fracture is reduced by taking this high-rich fiber diet.
Thank you. Thank you so much, ma'am. Ma'am, as we are having little paucity of the time, so I'm coming to the very important question that what is the most unhealthy diets we can say for the menopausal ladies? Huh.
The most unhealthy diet is that the highly saltish diet, the processed food. We should always prefer to take unprocessed food that's freshly prepared. The stored things, the canned things, the beverages, and all such things, all fried stuffs, and high carb, that is canned sugar, so many things. That is
Correct.
the things to be avoided, and better go for freshly prepared things, and mostly salads. They're very good thing for us. Caffeine, alcohol, high carb diets, added sugars, and high sodium foods are the things to be avoided.
Yes. So very nicely, madam has pointed out. Yes, coming to the specific point related to caffeine. So as already the lady is suffering from lot of hot flushes, but if she is taking again the caffeine intake is more, then this process will be more shoot up. So we have to very specifically tell to the menopausal ladies that caffeine is not only in tea and coffee, but also in this beverages also what are available
Yeah.
in the market these days with the name of the that they are not having the sugar, but they are having instead of the sugar they are having the sugar free, but they are having a very high amount of the caffeine. So better to be very conscious. So as we know, the usual limit is 80 to 120 mg, but not more than 200 mg per day is allowed for the caffeine.
It
So
affects the
this is a
sleep
very,
also. It affects the sleep
yes, it
also.
affects the sleep. It affects the sleeps also. Because in the menopausal ladies, again, we are seeing a lot of patients are coming to us with the forgetfulness and sleeplessness nights. So sometimes we have to give this melatonin 2 to 3 mg at night
Yeah,
to
yeah.
get a perfect sleep. So yeah, thank you so much, ma'am. Very nicely you have covered all the points. Ma'am, we have
And
received,
one point I would like to add, you can
yes, ma'am.
have this
Yes.
boiled garlic. That will reduce us
Okay.
to get reduce our cholesterol levels. Help us to reduce our
Okay.
cholesterol levels. Because I am having
Boiled garlic, ma'am.
white garlic.
Boiled garlic.
Yeah, yeah, yeah.
Achha,
Yeah, you
means
just
how
boil
you
it
take
and
it,
then
ma'am?
have five pieces of garlic at night before you go to bed.
Okay.
That's very good in
Acha,
reducing
okay,
the cholesterol level. It's good for heart
okay,
also.
okay, great, great, great. Thank you for sharing such nice tip, ma'am. So, ma'am, we have received some questions in the chat box.
Yes, ma'am.
That must be visible to you also. Um,
Ma'am, we can read it out for you.
Yeah,
Yes, ma'am.
please read it out.
Okay. Can I
Yeah.
read the first question?
Yeah.
Yes.
Yes. Ma'am, the first question goes, how can clinicians differentiate between menopause-related weight gain and metabolic syndrome?
Yeah, menopausal related weight gain means around perimenopause. If they usually women gain weight after menopause, it's because of lack of estrogen and other things. And this metabolic syndrome means they must be overweight even before the age of 40 or so. The central obesity is considered to be the metabolic obesity. And menopause, of course, you have uniform obesity all over the body. And the central obesity is, of course, will be part of that also. But you can differentiate by doing your blood workup, so that if the uh, triglycerides, the low density lipoproteins are very high, and if the sugar is high, that means it is more of a metabolic, and it usually occurs at an younger age group itself. And that obesity may continue into the menopause too.
Yes. And ma'am, the
A
next
person
question
will be
we
very lean before menopause and around there is perimenopausal age. If they start gaining, means it's menopausal obesity.
yes. Yes, ma'am. The next question that we have received is, how does diet affect gut health during menopause?
I think
I
this
Yeah,
we have
think we
we
have
discussed
already
this.
discussed that.
Yes,
yes,
already discussed. Yeah.
yes. Ma'am, the next question is, how can women adjust their diet if they have both menopause and other chronic conditions like diabetes or BP?
Yeah, we told that, you know, the high carb diet to be avoided. If the person is having diabetes, better to avoid high carb. She can take just 1/3 of carbohydrates in her diet and lot of fiber containing, that is vegetables and salads and the things that should be of half a plate, and proteins, high protein diet. So everything should be a balanced diet.
Yes.
So that, and better avoid all fried stuffs, all fast foods,
Yes.
in order to get rid of this BP. BP patients, those that are having high blood pressure, you have to restrict your salt intake. All these pickles, we are South Indians, we are so fond of pickles.
Yes,
we have to avoid it.
very much.
All fried stuffs, dry fish, so many things which are very saltish have to be avoided.
Yes.
Here, I want to add one point, as Madam has very rightly pointed out. This remind me. So, because once the lady asked me for the same question, na Namrata, so I usually tell them you have to avoid three P's. P's for pickle, P's for papad, P's for pakoda. So you have to avoid these three P's, huh? Pickle, papad, and pakoda you have to avoid, huh? So
Yeah.
yes, because once we are making this pakoda, we are adding a lot of oil.
Oil.
So that
And
are oily
Namrata
stuff.
is also a South Indian. I'm sure she can relate to it very
Yes,
well.
I'm relating.
Okay, okay,
For the event, I
okay.
also spoke to ma'am, and she's like, "Yes, you're a South Indian. You know, you eat pickles a lot."
Yeah, yeah. We South Indians are fond of pickles, you know.
Yes,
Everybody is fond of pickle यार किसको अच्छा नहीं लगता है आम के
सबको
मौसम
अच्छा
में
लगता है.
आम का अचार
Yeah,
किसको नहीं अच्छा
yeah.
लगता सबको अच्छा लगता है ना
Ma'am, we are
तो
Punjabis and we like it with parathas, you know. We cannot survive
हाँ
without pickle and paratha. P for another thing for paratha for us.
Yeah, whole wheat is very good. Whole
yes,
grains, they are very good. They are rich in fibers, and better go for whole grain bread, then brown rice. This we have plenty of high fibered rices. You
right
know,
yes
yeah, we can
brown
go for
rice red
millets.
rice
Yeah, millets are very
yes
good for health.
yeah
So we can go for
yeah
them.
yes.
yes
Ma'am, the next questions that we have received, I think you have already covered it, prebiotic one, and also alcohol consumption and caffeine in menopause and diet. And ma'am, the last question I would like to ask is, what will be the takeaway message as a doctor for
Wait,
like
wait,
during
for the
menopause?
alcohol, I want to add. No?
Yes.
Yeah, today I only have seen one patient in the OPD. She is 54. So menopause 2 years back only. A very fit lady, huh? She asked me, ma'am, I read lot of things on the Google and accordingly I planned my diet. But still, I am not able to quit the alcohol. So, do you suggest me any form of the alcohol which I can take, which is safe in the menopause? Huh? So, I told by I am having very less knowledge about the alcohol. So, anyhow, she told me, "Ki, ma'am, I have read somewhere that red wine is very good. So, can I take that on the regular basis instead of beer and vodka?" So I told her, yes, compared to other things, yes, red wine is
It's better.
little better, little better. Then she just now she sent me a message for some 4, 5 more drinks. Actually, I am also not aware of that. So is it like that? Some kind of the drinks because yes, because see these days where I am practicing, where Madam is practicing, we are having a lot of corporate patients, and
Mm.
alcohol and smoking
Yeah,
is their
smoking has to be
daily.
avoided. Yeah,
Yes, yes.
yeah, we have to avoid that. And
Yeah,
everything has its own limitations.
correct.
In
Yeah,
Tamil, we say, அளவுக்கு மிஞ்சினால் அமுதமும் நஞ்சு. If we take more and more in quantity, even the best thing, that is amudam means the I don't know how
Excess.
the exact, yeah,
Excess.
yeah, even excess, anything excess will definitely harm our health. Okay. And exercise, of course, we should stress
Correct.
on that. At least
Yes.
30 minutes a day and
Hmm.
150 minutes per week is very essential. Then this is the weight balancing exercises and muscle strengthening exercise twice a week is very essential to keep us very healthy. That is very essential. We have to stress that also. You can practice yoga and also other things. But
True.
please see that it doesn't make you more breathless. If it is that, you have to stop it. Okay.
Correct. Yeah, Namrata, Namrata is asking something, na? Last question.
Yes, ma'am. The last question was, what was your takeaway message as a doctor for patients experiencing a menopause?
Yeah, I already told that proper exercises, proper diet, so that we can have stronger bones, stronger heart, stronger muscles, improved endurance, improved mood, better night sleep, healthy weight, that's very important, and reduced risk of cancers and social connections that boost mental as well as physical health. That's my takeaway message. Taking good
Very
diet,
nicely, ma'am.
yeah.
Yes. Very nicely you have pointed out, ma'am. So similarly, I also say to my patients that consider your body as a temple. This is the
Yeah,
time, menopause is the time when you're having a lot of time to spend, to do the worship in the temple. Similarly, you can involve in all of your hobbies, but you are not able to do at the time when you are
we're
not
so
having a time in
busy.
the younger age. Yes, you are too busy. And try to maintain your weight. So sometimes the patients tell me, ma'am, abhi to humse hota nahi. We are having joint pain and all these things. So I always tell them there is a simply a difference of word I from fit to fat. You can do anything. So if you want, you can do anything. So better instead of getting fat, you can be fit. So these are the some important things. There nothing is impossible because we all know this is a very famous phrase that I am possible. So there is nothing impossible. So, and as rightly madam has pointed out, the social connects is also very important because in the menopause we have seen lot of ladies are going in the depression. So that is also very important. Social connects. We can use the social media for the good thing also. So getting a social connects is also a very important thing. Yeah.
Yes.
So I think all the questions are finished. So we
Yes.
can wind up for the today's session. Huh.
Yes, ma'am.
Yeah, thank you so much for giving me this opportunity. I thank both Narmita and Ritu for giving me this opportunity. Thank you
Yes,
so
Most
much.
welcome.
Yeah,
thank
good
you
night.
so
Most
much,
welcome.
ma'am. Thank you so
Most
much, Dr.
welcome.
Ritu Santwani and Dr. Yazhini, for an insightful, engaging, and eye-opening session on menopause and diet. And to our viewers, we thank you for joining us. And we hope this Med Talk has enriched your understanding and sparked important conversation around patient education and dietary guidance in menopause. And don't forget to explore more such expert-led sessions. Stay tuned, stay informed, and stay empowered. Until next time. Thank you for everyone.
Thank
Thank you
you.
so much for joining in, ma'am.
Yeah. Bye-bye.
Thank you and
Bye.
good night. Bye.
Good night. Good night. Good night.
Very, very good.
Sir. How are you, sir? How are you?
How are you?
How are you?
We are good. So happy to see you. Thank you so much for this.
Same
connection.
here. Same. Sir, we still miss the Ooty trip. So when we miss
Very
the
nice.
Ooty trip.
We remember.
Oh, yes.
Very nice.
Yes.
How is your sister?
She's also fine, Shilpa.
Your
Sir is
sister?
asking about you. She's
Cold.
having little cold.
Cold. She's cold.
Oh,
Cold.
okay.
She's coming. She also want to say hello to sir. No, session is over. Come this side. Come this side. Any side you can come. उससे पहले वो लोग बंद कर दे जल्दी
Hello, sir. Good evening.
How are you? We
I'm good,
miss
sir.
you.
Thank you. How about you? Yeah, so do we, sir. Yeah, we really
Come
cherish the
Bangladesh
time with
sometime.
you all.
Come to
Yeah.
Ma'am,
Bangladesh sometime.
definitely
She's
will come,
inviting.
will come.
Yeah, yeah. I'll just call you.
Acha, okay, ma'am. Okay, ma'am. Bye. Bye.
Okay, bye, bye, bye. Good night.
Bye.
Good
Good
night,
night,
good
ma'am.
night.
Thank you
Good
once
night.
again. Bye.
Bye, bye.